Good evening, I'm Jeff Glor. It began as a medical crisis. It is now a political and legal one as well. A nurse under mandatory quarantine tonight has a lawyer. The governors of New Jersey and New York say they have a policy they're sticking with. Those mandatory 21-day quarantines for medical workers arriving from West Africa who've had contact with Ebola patients, whether those passengers are showing symptoms or not. The White House wants those rules changed. They haven't said how. We have two reports tonight, beginning with Jericka Duncan.
Casey Hickox sent CBS News these pictures of her isolation unit at University Hospital in Newark, New Jersey. Hickox gained national attention Saturday when she wrote an article in the Dallas Morning News criticizing the new mandatory quarantine process, saying she was questioned as if she was a criminal. The hospital where Hickox is staying issued this statement. While we understand that the required quarantine is an inconvenience, the patient continues to be isolated in a climate-controlled, extended care facility area that is inside a building that is part of the hospital. CNN spoke to Hickox this morning.
I have kind of a porta-potty type restroom, no shower facilities, and no connection with the outside world except my iPhone, which I insisted that I brought with me when I arrived late Friday night.
ACLU attorney Norman Siegel represents Hickox. The organization issued a statement that reads in part, "By forcibly detaining people, we are also frightening the public, while also discouraging caregivers and first responders from helping sick patients who need their assistance." Some state and federal officials are divided on the mandatory quarantine policy now in effect in 3 states. Today, New Jersey Governor Chris Christie defended the protocol.
I don't believe when you're dealing with something as serious as this that we can count on a voluntary system. This is government's job. If anything else, the government's job is to protect the safety and health of our citizens.
Dr. Anthony Fauci of the National Institutes of Health appeared on Face the Nation with Charlie Rose.
Right now we have a devastating epidemic in West Africa, and we're having an epidemic of fear in the United States.
Critics of mandatory quarantines are concerned healthcare workers like Hickox and Dr. Craig Spencer, who contracted Ebola, will be discouraged from traveling to West Africa, knowing they'll have to stay in quarantine for 3 weeks upon their return, even if they are not showing symptoms of the deadly disease. Doctors here at Bellevue say Spencer is doing a little better than yesterday. Jeff, right now, Spencer is in serious but stable condition.
Jericka Duncan, thanks very much. All right, we're joined now by our chief medical correspondent, Dr. Jon LaPook. He has spoken to Casey Hickox. John, how did she describe her homecoming to you?
When she first arrived at Newark Airport, it was all smiles. Then when they found out that she was in Sierra Leone taking care of patients with Ebola, the smiles evaporated. And she said she felt like she was being treated like a criminal. They actually took her temperature, and it was transiently elevated, which she thinks was a false positive because she was so flushed. Then she was transferred to University Hospital in Newark.
And she is in a better spot for her, she thinks, now.
Yeah, she's tested negative for Ebola. She has no symptoms. She feels perfectly fine, and she says they're treating her very well over there. But her big complaint is, where do I go from here, and do I really have to be in this tent?
But some people are asking, what if she does test positive?
She said that she's already had known by the protocol from MSF, that's Doctors Without Borders, exactly what to do. She's been following her temperature. She's planned to do that. Back in Maine, there already was a preordained place that if she did test positive, she would go there. She's been in touch with the state epidemiologist. She was following protocol, and she said the science says unless you have symptoms, you're not infectious. And she said, why abandon the science here? That's her big complaint.
Dr. Jon LaPook, thanks very much.